hello to all the viewers. With me, I have Dr. Alan James, who for the current INISS DM Neurology exam has secured rank 17 in the common merit list and in the AIIMS merit list a rank of 21. So Alan, heartiest congratulations and welcome.
Thank you, sir. Thank you.
All right. So Alan, the first ever INISS exam, a very prestigious exam, and a lot of uncertainties, exam pattern changes, everything, going around. The overall journey, was it tough?
It was very tough, actually, sir. Actually, I was concentrating much on the specialty, actually. So I was not much into medicine part, but in between, I was making sure that I'm not getting out of medicine. But if someone asks me to appear for an entrance exam, which is entirely based on medicine, definitely my confidence level would be very low. But neurology means I was day by day, I was reading and I was able to, means I had that confidence. Neuro means whatever the toughness level we can manage.
Okay.
So towards by few months before the NEET, this exam pattern has changed and definitely was a lot of pressure.
Okay, all right. And Alan, first of all, viewers will like to know about yourself, your MBBS days and MD days. So can you just tell a bit about yourself?
Yes, sir. So I am from Kerala. I did my MBBS from Amala Medical College, Thrissur, and I did my DNB Medicine from Christian Fellowship Hospital, Lodanchatram. It's a mission hospital attached to CMC Vellore. So that's my background.
Okay. So when did you finish your MD?
I finished in 2019 October, sir. Then, but I didn't start the serious preparation after that because my wife was doing MD those days. So we thought like we'll shift together. She will be finishing by 2021. So 2021 NEET was my target. So in between, I was just reading till 2021 February. I used to read in between, maybe some few pages. That's all. But that was not serious preparation. And I joined in her college as senior resident after my course. So 2021 March I resigned, planning for this NEET. Then I started my serious preparation actually. So started with Harrison. So coming to the books from where I read, I started with Harrison Neurology. So initially I made sure it means 100% of Harrison Neurology I have read about. Then after that I switched to some important chapters in Bradley because some topics in Harrison Neurology is very deficient, like congenital myasthenic syndrome, then stroke, then epilepsy, then neurocutaneous syndromes, then some dystonia. So these topics I felt Harrison is inadequate. So these topics I read Bradley and few other topics also in between. Means when I felt like we should read, I went through Bradley those topics. But these were the topics I would like to highlight for all juniors who are planning. Definitely you read through Bradley.
Okay. So that is, one very important point that you just told, because often when students start preparing for INISS or NEET-SS, one of the first questions that they would have is Harrison alone enough? So you've already said that. See, Harrison is very important. But at the same time, there are certain topics where Harrison is deficient, like stroke part, and he's rightly saying about dystonia, congenital myasthenic syndrome. So even, congenital muscular dystrophies, congenital myopathies.
Yes.
So these areas are not well covered in Harrison. But when you appear for a INISS exam, you have got to be thorough in that, and you've got to prepare accordingly. So that is a very, very important message to everyone.
Yes.
One question, Alan, you said you were taking a small break after your MD.
Yeah.
But tell us, when did you decide that, okay, I'm going to go for neurology? Was that an automatic choice that came during residency?
Yes. So that I decided in my second year. Second year beginning itself, I was very clear. While actually during house surgency and all, I was like more inclined to nephrology.
Okay.
But even for it was first year PG also it was like that. But second year onwards, we will be put on for super specialty posting. So that was the time when I had more exposure with each specialty. So then only I was able to identify which is the specialty which suits me better. Okay. And another point was actually in our hospital, our senior most physician was even though he's a physician, he was very much interested in neurology. So he had a huge number of patient bank, especially neuro patients, demyelinating disorders, all movement disorders, and all. He's around 80-year-old, but he had a
Yes.
very
Okay.
he did MD from CMC almost 50 years back. But
Okay.
so he is very interested in neurology. So he used to call us to his OPD and show certain clinical signs which he used to do during his MD days. So the neurology was the specialty which I had more encountered compared to others. That may be one reason. So, but second year
Again, that
onwards,
shows sir's commitment, at 80 years,
yes,
being actively involved in treating patients
yes,
and
yes,
also teaching.
yes, yes.
Okay, where
Yeah, every Monday,
99%
sir used to
would
take.
prefer being at home at that age.
Yes, yes, sir. Every Monday, he will take neuro clinics at this
Okay.
age. Every
Okay.
Monday. Even now, during COVID days, also, my juniors are telling he is taking Zoom class every
Okay.
Monday. So that he is continuing.
Okay.
So he was the first person I called and informed immediately after the
Great.
first.
Good. Good. That's great. I'm very happy also, like, you are remembering your teachers also, calling them and informing, which is very important.
Yes,
I feel, we might go forward, but always, you should turn back and look at who all actually helped us
yes, sir.
reach the position there.
Definitely,
Because
without
you
their
have
blessing,
now,
we cannot. Yeah.
you have now got NIMHANS also. The counseling is also over, and he's going to be in the country's premier institute for neurology. So, which is a great, great achievement. So, Alan, coming to doc tutorials. So, Alan, the time that the exam pattern change happened, doc tutorials came up with the elite exam series,
Yeah.
and you were regularly following the elite exam series as well. So, at that particular time, when the whole sort of pattern changed, and then we had a separate WhatsApp group
Yes,
with
yes.
our students preparing for the neurology. So, how did the creation of such a group, such exams, how did that actually help you keep your momentum?
Definitely not like our PG days. NEET PG preparation, we won't be having any other competition. Mostly we'll be in one hostel staying and completely dedicated to our study. So, but for super specialty, we'll be having a lot of other priorities. So definitely we should be in a group of similar people who are also working for the same cause. Then only we can maintain that momentum till the end. So especially during that pattern change days, actually initial days I was thinking, I have read this much of neurology, so now everything went in vain. So how can I start again with medicine? So that was the time actually I subscribed Elite series. So and it was start immediately within 1 week of the new schedule, means new pattern that came out with a new schedule for medicine. And then it means thought like, okay, now means we can go with this plan. There is a schedule is there. So, but anyway, finally, again, it was reverted to the old pattern. Yeah. So that was a great relief actually. But from June, I think June onwards, I was totally following doc tutorials. I was continuously watching your WhatsApp group, seeing all those messages, all explanation, all voice messages, and I used to note down in my note, means add-on points. I used to note down just to make sure I'm not missing anything. And something also, even though we read Harrison, you will think like, okay, I mean, I have read 100% of Harrison. So any question from Harrison, I won't miss. That will be your feeling, but that's not actually true. There may be some points which may not click on on our brain, but that may be a potential question for exam. So those things you have pointed out in your this voice messages, WhatsApp questions in between scenarios and all. So those things I used to refer back in Harrison, and I'll be surprised to see, since I had already underlined that point, but that time I was not able to click that clinching point in that. So yeah, that is another way.
And what about, the after the elite exam series came the mock exam.
Yes.
So see, majority of the students who actually wrote the elite exam series, many of them were consistently in the top 10 in the elite exam series, and even in the final mock exam also. It eventually, the final rank list also, the same rank happened. So like Pushkar was rank 1 or 2 in most of the exam. He was rank 1 in the AIIMS merit list. Prachi was also consistently in top 10. Shalini was in top 10. So they came in top 10. And I still remember a few days back, I had an interview with Vedang. So Vedang's rank was 16 in the INISS mock, and his rank was 16 in the final. So what was your rank in the
Yeah, in mock test, INSS mock, my rank was 11.
11? So 17 was your common merit list.
Yeah. But that is actually accurate actually, because when I went for reporting in NIMHANS also, all the 10 students there were in this elite group actually. So all those who are preparing for neurology, all students seriously preparing, all will be there, all were there in the group. So we'll have a very good idea after attending the mock test. I don't think anyone else will be there who is not there in the group who came to the top 30.
All right. So regarding the after the INISS results, then for AIIMS there was a specific interview round also.
Yes.
So I know that at that particular time, there was a health issue in your family, and you were quite held up there, and I think those were stressful days for you as well. But just tell us about the interview round. So in fact, I had conducted 2 days of mock interview sessions as well, and you attended those mock interview sessions. So were those sessions helpful?
Yes, sir. Yes. Actually, I think for interview every year, they are having a common pool of questions, and the same questions only they will be asking means each year. So these questions actually sir has put in the group actually from the previous year candidates. But means I had seen this question, but I was not prepared specifically for the interview. But coming to the interview is actually
I know that the day before the interview and the previous day, you were in hospital. And I know that you attended those mock interview sessions also from the hospital also.
Yes.
So just tell us one thing. You have attended the interview. What sort of questions came in the interview? Because already I had shared the questions in the group, because many of the previous batch toppers were also my students. So they had shared the questions with me, like what were the interview questions. So all the questions asked to all the toppers I had shared in the group.
Yes.
Unfortunately, you could not get that time at that particular phase because you were in hospital. So majority of the questions, even those who had attended the interview also, majority of them got either the same question or the maybe closely related question only. So just tell us what is being assessed in the INISS interview round, as someone who has attended the interview, and you can advise your juniors. Okay, if next time you are qualified, you just tell to them how to prepare for the interview and what sort of questions are being asked.
Yes, sir. So for interview, actually, it's not a very difficult thing to appear in an interview and all. It's very comfortable atmosphere only. So only thing is we have to be trained for an interview rather than a theory session. So it is all about presentation, the way we present. So the moment the questions, I will tell the questions. Actually, I got 2 questions. One was bilateral hand wasting. So that is they didn't mention anything else. Bilateral hand wasting was displayed on the screen. So we have to start with causes, etiology. So we have to frame how to present in our own mind, and then we have to elaborate. So it was not like causes of bilateral hand wasting or approach to bilateral hand wasting. It was just given bilateral hand wasting. Then he asked me to start speak up. Then other question was an elderly lady with subacute onset pancerebellar syndrome. That was a scenario. Okay, so for that, the interviewer was asking specific questions. What can be the causes? How to approach? Okay, so it's all about how we present. It means we have to be confident and our presence of mind, and we have to go in an structured way. And they won't intervene also in between. Unless we stop, they won't intervene in between. So actually, bilateral hand wasting, it was my mistake. I didn't start in an organized way. So in between, I had to stop. I jumped with an answer. Then I thought like I had to start with etiology. Then I had to go back. So
but I know that you were not in a mindset also for the interview.
Yes. I just wanted to finish off that. So
yeah, I know that because you were in the hospital and you were not in a scenario. Mindset was not there. But I think that bilateral hand wasting, that question was there in that list that I had given.
Yes, it was there.
Yeah.
Pancerebellar syndrome, I don't remember actually, but bilateral hand wasting, it was there.
Correct.
So interview actually, it's not a difficult thing. We can just our UG and PG days, we have taken a lot of seminars, and with that cool mind we can go. It's not. They are also very comfortable. So initially before the starting of session, interview, sir told like, means just relax, nothing. So I will be asking the question. I'll be displaying on the screen. You can just relax and give the answer. With that, even they are comforting us. So it's not a difficult thing actually. We know the stuff, but only thing is we have to organize and frame it in a way that we can start from A and end, means go till there. And they won't intervene also in it.
Okay.
So for anyone planning for interview, got selected, then we have to train ourselves. Common scenarios and common questions we have to collect, and we have to prepare ourselves how to begin with if such a question has come. So then definitely we'll be able to score a good mark.
Because every year, I have conducted such mock interviews also. Even last session, the before that session also. But that time we had more gap between the results and the interview. But here, the day the interview date was announced and the actual exam, there were only 2 days gap, correct?
Yes,
2
sir.
days. So, yeah. But still, in those 2 days, we had conducted marathon mock interview sessions. Yeah, all right. So thank you so much, Alan, for joining and sharing your inputs with, your juniors. And definitely for the next session, when they are being called for interview, I'll be asking your help also with the questions. You have already shared it to me.
Yes.
So that that'll actually help the juniors also. Because see, only if you know what sort of questions are being asked, you'll have that anticipation. Because I still remember in the interview with, I think, Shalini, so she told me there was one question that I had discussed in that group regarding open ring sign in multiple sclerosis. And that was there in the questions I shared in the group also. And immediately, I think my student Chitrangada got it last time. So this time Shalini saw the screen, she saw that question. And so sometimes luck comes in your favor also. But again, you have been blessed that you are actually in AIIMS. So enjoy your life, both in the professional and personal fronts. Okay. So all the best. And thank you so much for joining.